Hello, you guys. Here is our NCLEX style practice question presented by Apex Nursing Academy. The nurse is caring for a child with sickle cell anemia. The nurse instructs the parents about precipitating factors to sickle cell crisis. Which factor, if identified by the parents, would indicate further need for instruction? Now, anybody that knows Apex Nursing Academy knows the number one test taking strategy is to repeat the question, especially with these multiple choice type questions. You want to repeat the question, then go right into recognizing your cues and analyzing your cues. Recognizing cues just means picking up the significant data from the question. You want to focus on what your question is telling you and what your question is asking you. So, here, we're taking care of a child with sickle cell anemia. We're instructing the parents about precipitating factors to sickle cell crisis. And it's asking which factor would indicate further need for instruction. So that's the significant data. And we want to just go through analyzing the significant data, pulling our nursing knowledge to the forefront. What do we know about sickle cell anemia? What are we teaching to these parents? What are we teaching about precipitating factors? And it's also asking us the indication for further need. So that's a negative event query, which means we're going to be looking for the wrong answer, right? So let's talk about sickle cell disease. This is where you want to bring your nursing knowledge to the forefront. Think about your significant data. Our significant data revolves around sickle cell disease and teaching. So, sickle cell disease is a genetic disorder where you have abnormal red blood cells. You got your normal red blood cells you can see on the left, and then on the right you see you have the sickle shaped red blood cells. Now, your normal red blood cells, your your red blood cells are going to carry iron, nutrients, oxygen. They're carrying that in the blood vessels to the tissues. But the sickle shaped sickle shaped cells. Think about those cells going through the blood vessels and they're mixed in. You got some normal red blood cells, but the sickle shaped red blood cells, it's difficult for them to carry that iron nutrient, difficult for them to carry that oxygen. And because of their shape, they're going to be clumping together. You're going to have reduced oxygen available to the tissue. That's going to cause pain, ischemia, worsening anemia also happens in sickle cell crisis. So when you're taking care of someone with sickle cell crisis, you're going to be focused on your interventions here, which is administer oxygen, of course, maintain hydration. It's very important to get those IV fluids going. They may have to have a blood transfusion. They're going to be needing pain medicine. They may need antibiotics. If they have some kind of infection going on, you want to treat that you want to treat that infection with antibiotics, because you'll see later on, we'll talk about infection is one of the precipitating factors to sickle cell crisis. So you want to treat that infection. You want to assess and monitor for shock, anemia, and you want to educate on crisis prevention. So I was talking about precipitating factors, and infection, yes, is a precipitating factor. I cannot talk today. A precipitating factor to sickle cell crisis. Um, So, fever is another one, infection, dehydration, emotional and physical stress. So, these are precipitating factors, meaning these factors, when this situation is going on, fever, infection, dehydration, emotional, physical stress, trauma, all of these things going on can cause exacerbation, really, can cause exacerbation. And that could just cause these sickle cells to really exacerbate in the body, to really flare up, which is what the sickle cell crisis is, okay? So you really want to be teaching and being prepared for sickle cell crisis. Now let's look at the answers. Stress. That's going to be a correct answer because stress is a precipitating factor to sickle cell crisis. Infection, we talked about. So, yes, that is a factor, a precipitating factor to sickle cell crisis. Fluid overload. Now, if the parent, you've done your teaching and the parent tells you, well, giving fluids, giving too much fluids, that is a precipitating factor. I shouldn't give a lot of fluids. That's going to be a red flag, right? That's going to indicate a need for further teaching, further instruction, because dehydration is a precipitating factor to sickle cell crisis. So you don't want the parents thinking, hey, we don't need to give fluids. We don't need to give additional fluids. Fluid overload is not a precipitating factor to sickle cell crisis. And then, of course, trauma, that is physical stress, that is a precipitating factor. So, of all of these answers, if the parents told you fluid overload, right, that's going to indicate further need for instruction. So you have to be very careful about negative event query questions because they're looking for the wrong answer. They're looking for the wrong answer. They're looking for, if the patient is telling you the wrong answer, the person, whoever they're talking about, is telling you the wrong answer, that is indeed the correct answer that you are looking for. So you just have to bring your nursing knowledge to the forefront. Remember to think like a nurse. Think like a nurse. Use your cognitive skills, which is recognizing cues and analyzing cues. Only use what's in the data that's in the question, and then bring your nursing knowledge about that data to the forefront, and then be careful and mindful of what they're asking you and pick the correct answer. Continue to use your cognitive skills. One of the best ways to prepare for NCLEX is to do practice questions. Do your practice questions, look at the rationale. Even if you get the answer right, still look at the rationale and see, why is this right? Why were those answers wrong? You'll be amazed at what you will learn. That is the number one way to prepare for NCLEX, is to do practice questions daily. You guys can do this. I will see you next time. Have a great day. Bye bye.